Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a special presentation on COVID-19 pandemic. Today we're going to look at how we can answer the question, when is it safe for people to return to work? Actually, there are hundreds of thousands of people who are already working in retail stores like Walmart, Kmart, HEB. Similarly, there are tens of thousands of people who are working for online services and for delivery services. Are they using any special tests to make sure that the people who work in these places are not spreading the virus, and two, they are not getting infected by going to these workplaces? I was in Walmart a couple of days ago. I have seen they have made some changes. They have put some plexiglass in front of checkout counters to protect the employees from exposure to the virus. They are also constantly announcing social distance, wearing masks, and washing hands, the usual things we have been bombarded during the last 4 to 6 weeks. Keeping that in mind, I don't know if they are doing any testing before they hire new people. As a matter of fact, last week, Walmart announced 100,000 new hires, and they are planning to hire 50,000 more people to serve all their centers all across the country. So there is some evidence that people are already working in these places, and let's figure out from a scientific point of view, from a medical perspective, how, if I am asked as a doctor, this batch of 100 people, are they ready to work? Are you able to certify? That's the question we are asking. I don't know if we have the answer, but let us explore further and see if we can find a reasonable answer to make sure the person is least likely to get infected, the person is least likely to spread the infection at the workplace. Those are important questions we need to keep in mind. Now let's look at what is happening across the country. First of all, the epidemic is in different stages in different states. New York, which started off as the epicenter, now has 181,000, and they had added 8,786 new cases on April 11th. These are all new people who have tested positive. So they are likely to be potential candidates who could spread the virus if they return to work. So how do we make sure these people are not spreading the infection? And similar story goes with all these hotspots that are popping up every week. Let's proceed further. Let's look at New York City, for example. Even though the New York City graph shows a very promising decline in the number of new cases, let us not forget those people who tested positive in the last week are all potential candidates for spreading the virus. Even after 2 weeks, I will show you they may still be carrying the virus, and they could be potentially spreading the virus if they return to the workplace. Now, to answer this question, here is a beautiful study that was reported in Clinical Infectious Disease Journal on March 28. They did tests on symptomatic patients. We know that there are 80% of the people are asymptomatic, so they didn't even look at asymptomatic patients. They looked at the population who had symptoms. Okay, let's take this data, for example, as a foundation. Those people during the first week, 67% were positive by RNA test. By 2 weeks, there were still 54% of the people who were positive. By the end of 39 days, they still had 45% of the population who tested positive for the coronavirus test by RNA-RT mechanism. That means there are 45% of the people who could be still carrying the virus and has a potential to spread it to other people. Okay, let's look at the other side of the coin. If you have been exposed to the virus, you should be able to develop antibodies. They tested the antibodies in this population. They found out that during the first week, 29% of them had developed IgM antibodies, and 19% had IgG. IgM is the immediate response antibody, and IgG is the long-term response antibody. And by second week, almost majority of the people had developed antibodies to the coronavirus. And by about third week, 90% of them had developed antibodies to the coronavirus. So what does this data mean? This is a raw data. We need to find out how we can apply it sitting in front of, for example, a warehouse or a retail store and telling people, okay, I need to do this test to make sure that you are least likely to get infected or least likely to spread the infection. So those are two important questions we need to answer. As I said, these are the two important questions we need to answer. How likely you are to get infected at your workplace? So in order to answer that question, can we just do one test and say, okay, you are ready to work? No. Can we do both these tests to see if you are, one, not carrying the virus, number two, you have antibodies, so you are well protected, which means you are least likely to get infected or least likely to spread the infection. Would that help? So in order to answer that, let us look a little deeper into these two tests. If the coronavirus test is negative, that means most likely you are not carrying active virus, so you are least likely to spread the infection. On the other hand, if your coronavirus test is positive, that means you could be still having the virus and you could be potentially passing on that virus at the workplace. I don't know. We have never tested that hypothesis. Second, if you have antibodies, that means you are sort of protected from the coronavirus infection. So you are least likely to get infected. But if you don't have adequate antibodies, if you are exposed to a large viral dose, you could still get infected. We don't know. So to summarize, I would say if you do a coronavirus test using the RNA method, and if you turn out to be negative, that means you're not carrying the virus and you're least likely to spread the infection to other people. At the same time, if we do an antibody test and it shows that you have both the IgG and IgM antibodies by end of second or third week, that means your body has developed antibodies against the virus, so you're least likely to get infected by the virus for the second time. So that is my analysis. I don't know if we can implement doing these two tests to screen and see who is least likely to spread the virus and who is least likely to get infected before we let them come back to work. That's the biggest question we have to answer as medical professionals. It doesn't matter, even if these two tests say that you are protected and you're least likely to get infected, still I think it is very important for us to follow the same principles that we have been doing, such as wearing masks, maintaining social distance, washing hands with soap, so that we are least likely to get infection from some unknown source or spread the infection without knowing that we are carrying the virus. So that is my analysis of this entire scenario. It is a very complex analysis, but we will see what kind of safety measures they're going to implement to make sure when the employees return to work, they are least likely candidates to either spread the virus or get infected by the virus at the workplace. Ladies and gentlemen, thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and we will see you next time.